Hi. So in this capsule, we'll be discussing what you need to do in your 9 months of pregnancy. I hope you've seen my earlier capsules, one on the preconceptional checkup which you need to do with your doctor. I'll leave a link somewhere there. And I also hope you've seen that capsule on the overview of pregnancy, which was the preceding capsule to this one. So in this capsule, I'll be assuming that the pregnancy is uneventful and uncomplicated, as I did in my earlier capsule, because complicated pregnancies tend to have very, very special advice. But the vast majority of pregnancies are actually uneventful and uncomplicated. So this capsule should cover most of you. So as soon as you miss your period, so I'm assuming you're doing your menstrual diary, again a link up there. I'm assuming that as soon as you miss your period, you would have noted it in your menstrual diary. Well, that's when you need to do a pregnancy test, a urine pregnancy test. Please don't wait. For some reason, a lot of people do wait for a couple of weeks before they actually do a pregnancy test. Now that would be probably valid maybe in people who have irregular periods. But if your periods are going on regularly, there's no reason for you to postpone your pregnancy test. An early pregnancy test allows us to pick up some problems in pregnancy and allows us to manage it better. And especially allows us to pick up a problematic pregnancy known as an ectopic pregnancy. Of course, I'll be covering ectopic pregnancies in a future capsule. I would also assume that you have already met your doctor in advance of your pregnancy and you would already be on folic acid. For details of that, refer to my earlier capsule on pre-pregnancy care. In an average, normal, uncomplicated pregnancy, there is no reason for you to be inactive or be on rest. So my advice to all girls when they're pregnant is, if you otherwise don't have any medical reasons to avoid, be active. Whatever exercises you used to do before, you can do it. Probably not a good idea to include new exercises or new types of exercise which you're not used to. But again, if you have a good trainer, you could probably do that as well. If you're working at home or working at office, well, you can do that as well. There's no real reason for you to, put your whole life on back burner when you're pregnant. So unless you work in a place where there may be potential hazards, like if you're an X-ray technician or you work with hazardous chemicals. So barring these very rare scenarios, you can go to work. The second advice I give my patients is to eat healthy. We want you to eat healthy. We don't need you to eat for 2 people. Unless, of course, your pre-pregnancy nutrition was poor. We would just like you to eat what you used to eat during your normal life. So here we look at quality. We look at what does your baby demand from you. We look at what are we made of. So we are made of proteins and minerals. We are not made of sugar. So that's what your baby is going to require of you. So make sure that you eat foods which are high in proteins and minerals. Try not to have too much of carbohydrates. Concentrate on the minerals and proteins. I'll be taking this up in detail in another capsule. So again, your baby has got no reason to demand any food from you in your first 3 months of pregnancy, because baby has its own yolk sac from which it derives most of it or nearly all of its nutrition. Your baby is happy inside, it's getting its food from its yolk sac, you don't really need to eat. As long as you keep your fluid intake good, you'll be alright. So your increased food is probably really needed only in the last maybe 4 to 6 months of pregnancy, because that's when your baby really puts on weight. So what about rest? We say you need around 10 hours of rest per day 2 hours in the daytime and maybe 8 hours at night, which means you probably need to go to bed earlier. Now, whether you sleep or not is not really important. You need to lie down. And we prefer that you lie on your side. Left side more than right, definitely. We don't want you lying on your back for too long. But again, lying on your back is okay in the first 3 months of pregnancy. A light exercise would be good. A light walk, maybe around 20 minutes of a light exercise, would help your circulation, would help keeping your joints and ligaments loosened out, gives you some fresh air. I would normally ask my patients to read about breastfeeding and good parenting. Now, pregnancy is only a 9-month period in your life. It's an important 9-month period in your life, I'm not saying no. But you're going to be a parent for the rest of your life. So read about parenting. So do your research, find out good literature on how we should be good parents to our children. The other aspect I discussed was about breastfeeding. As soon as baby is born, everyone's assumption is that breastfeeding is natural. It should happen very easily. Yes, it should, but it's often not that simple. So you need to read about breastfeeding, or at least get in contact with a breastfeeding consultant or an advisor and learn more about breastfeeding. And if you can do this, learning about parenting and learning about breastfeeding during your pregnancy, you'll be well prepared once your baby is delivered. Now, make sure that you can contact your doctor for small issues. I normally ask my patients to contact me on a messaging service so that they can solve their small trivial issues easily and quickly, rather than wait for your next antenatal visit. Now, all doctors are different, so you'll need to talk to your doctor and get your idea how you can contact your doctor for trivial issues. Some doctors probably don't mind you calling them up. I would prefer my patients call me up only in emergencies. So similarly, every doctor would have their own protocol, so get to know your doctor, what they would require you to do to solve your trivial issues and how to contact them during an emergency issues. Emergencies can happen at any given time in a pregnancy. So you should know where you should go in an emergency and how you should contact your doctor in that emergency. No panicking at the wrong time. And in your last 3 months, it's probably a good idea to keep some basic bag packed, especially in your last month. And definitely discuss a birth plan with your doctor. Discuss with your doctor about where you would be delivering. Would your partner be allowed in the delivery area? Delayed cord clamping, pain relief during pregnancies. All these things need to be discussed with your doctor in your pregnancy, not in labor room. Please note that all pregnancies are obviously not the same. So there would be some restrictions on food or some restrictions on exercise and rest given individually to an individual patient. So just clarify with your doctor exactly what you should be doing during your pregnancy. So to summarize, I usually ask my patients to look at 4 things: good food, good rest, reasonable exercise, and peace of mind. So if you have these 4 things, you're really going to enjoy your pregnancy. Remember, your pregnancy lasts only for 9 months and it goes off in a flash. So leave the worrying to us doctors and you enjoy your pregnancy. Alright? So I'll be seeing you soon. Bye.